your cell membrane potential drop to 0, then you have cell death. Okay, so that's it. The cell can't function at all, it dies. And so when we're talking about why does it work? Why is it that we can take literally anybody with near enough anything and actually enhance the healing and accelerate the recovery? What we're actually doing is correcting the body's natural frequencies, or the range of frequencies. And what that does, it means that the body can then go, wow, okay, I can do the job that I'm designed to do, because your body is designed to heal, and the only thing that gets in the way, we get in the way with the various things that we sometimes choose to do or choose not to do. But also, obviously, our world is full of chemicals, and that's not a fault of regular humans, right? There's obviously a lot going on with that, as we know. But essentially, when you're talking about chronic disease as an issue for the body, it's regardless really almost of what you're thinking of, what label you give it, you're going to talk about a compromised cellular function. And so that's how I like to explain this, what we're talking about here, the bioresonance therapy, or the range of therapies that fall under this umbrella. Is that really we've got our cells, then we've got our clusters of cells, so that's our tissues, and then that comprises, then you've got organs and you've got systems. So you've got those different levels, but essentially, in order for your body to be healthy, then your systems and your organs must be healthy. So for that to be healthy, your tissues must be healthy, and for tissues to be healthy, your cells must be healthy, right? So I think that's something that is like fairly easy for people to understand. And essentially, a well-functioning cell must be able to take in and utilize nutrients, and at the same time dispose of metabolites. So basically any waste products, anything that the cell doesn't need, it will dispose of. So this transport in and out of the cell occurs via the cell membrane, but the problem is that the channels that facilitate those things, those ions going in and out, essentially they're like an electromagnetic, like electromagnetic valves. So this transport basically is determined or is dependent, the success of it is dependent on the cell membrane potential. And that is a very important concept, because if that's not optimal, then you're not going to have healthy cells, tissues, organ systems, or the body's not going to be healthy. So when we're talking about a healthy cell, you're going to have more negative ions on the inside of the cell, and then on the outside of the cell, the extracellular space is going to be more positive. But essentially, the difference between the two needs to be between minus 70 millivolts to minus 100 millivolts. And that's more or less basically where the healthy cell will be. Now, if that cell membrane potential is more positive or less negative, we're going to have a problem, because the functioning of the cells, the ATP production, so the energy production of the cell metabolism, protein synthesis, all of those functions of the cells will actually be negatively affected. So then, of course, there's going to be this impact on the tissues, organs, and systems, right? So that voltage is important, because even at minus 50 millivolts, the cell is already aging too quickly, and there's going to be some disease processes setting in. When that voltage, that potential, when that becomes even more positive, at minus 1.5, minus 15 versus minus 70, minus 100, that's where the cell can be cancerous. So when we're talking about cancer, we're talking about this cell membrane potential that is actually quite messed up, because it's actually a lot more positive than it's supposed to be. So then, just to really have an understanding of this, if your cell membrane potential drop to 0, then you have cell death. Okay, so that's it. The cell can't function at all, it dies. So this is quite a fundamental concept, because obviously, when we're talking about the whole body, you will, when you have that cell membrane potential being affected negatively, or rather becoming more positive, what you're going to notice that first in the places where obviously you have your weak links, and that's different for everybody. So for somebody, this may be chronic pain or fatigue or headaches or joint issues or whatever, right? So where you're going to start noticing it first is usually where your weak links are. But overall, if that is not corrected, then the body will age a lot faster and it will break down a lot faster. And so then people tend to end up with like one diagnosis, and then the next and the next and the next and the next, and they're just collecting diagnosis. But really, why is nobody taking a step back? And well, we are, right? But I mean, conventionally speaking, that's not even a consideration. And we know that's not even a consideration in the world of conventional medicine. So this is very, very fundamental. And this addressing the body in that way with those frequencies, like I said, is a lot more natural for the body than actually putting a drug in yourself or even a supplement. It's a lot more natural for the body to have this adjustment of frequency than it is to throw chemicals in whatever form, chemical agents in whatever form, whether it's pharmaceuticals or even nutraceuticals, to be quite honest. So that's basically the crux of it. You know, there's a lot more to it, but that if people understand it at that level, they kind of start to connect with it, I usually find.